Interventions with a king. Discussion and commentary based on articles from JACC, Cardiovascular Interventions.
I'm Spencer King. I'm speaking to you for JACC Interventions. Today I'm very pleased to have my friend visiting with me from Madrid, Dr. Fernando Alfonso. Fernando, thanks for visiting with us.
Thank you, Spencer.
I'm also very excited to have you here because there is a terrific article coming up in JACC Intervention that is going to deal with a problem that we are learning more about now that we have new technology. Now, we've known for a long time that acute infarction is associated with plaque rupture in many cases, and we've learned some things histologically over the years, but now we have OCT, very high definition technology, and the paper from Japan that that was submitted to JACC Intervention is coming out soon, helps us understand that. With that paper, I've asked Dr. Alfonso to write an editorial, which he's done, and very carefully examine this whole question of the morphology of acute infarction. Tell us first of all, tell us what this study was about from Japan.
Well, this was a very interesting study where they were using OCT in patients with acute coronary syndromes. In fact, 89 consecutive patients. Of those, 40 were ST elevation myocardial infarction, and 48 were non-ST elevation acute coronary syndrome.
So they're separating out the differences with the STEMI and non-STEMI.
Non-STEMI patients. And the unique finding of the study was that in the STEMI patients, the plaque rupture was very common, was more common than in the other group, and also they had more frequently thin cap fibroatheromas. They got a higher percentage of patients with thrombi, and most of those were red thrombus. And interestingly enough, the rupture cavity was larger in patients with STEMI and was orientated against the direction of the flow. So this is quite unique and novel information with regard to prior pathological or intravascular ultrasound studies.
So we didn't know this histologically before. And I noticed that you got Renu Vermati to join you on this, and she's looked at millions, I guess, of these sections of acute infarction and non-STEMI patients. So what do you make of this particular finding?
Well, pathological studies, they were mainly performed by cross-sections every 2 or 3 millimeters. But most of them, the prevailing paradigm is that the underlying mechanism of the plaque is similar, is plaque rupture in most of the cases, whether or not the patient presents with ST elevation myocardial infarction or non-ST elevation acute coronary syndrome. And this paper, for the first time, suggests that the rupture is more frequently located in the proximal part of the artery, and this can create a mechanism, a valve mechanism, that will produce more likely total vessel occlusion.
Well, this is a challenging idea that just the shape of the rupture could separate what would evolve into an acute occlusion with STEMI versus something that could continue flow, perhaps, like happens in non-STEMI. Well, this is a very exciting development. We think that this kind of research could lead us to new ways to look at things. As technology improves, we find things that we never saw before. So I appreciate your insight into it. Hope this stimulates some other people to think about this subject and help move the field forward. Thanks so much, Fernando, for visiting with us.
Thank you, Spencer. Thank you.